When the calendar turns to February 14th, romance comes to mind, and hopefully you can share the day with a loved one. But what if you've had a rocky relationship with your teeth? Dentist Steve Marsh is here with developments in dentistry that will help you fall in love again with your smile. Thanks for joining us today.
My pleasure, Armin.
So a lot of us get tongue-tied when we are trying to tell people how we feel, including telling our dentist what's going on. You have tips and treatments to untie our tongue, basically.
Yeah, and it's important that as a dentist we understand what the patient requires, what they want, what their history's been, what they bring to the table, what their expectations are. It's not just us putting them in a treatment room, but we really have an obligation, I think, to explain options and that sort of thing, but listen to the patient. One of the things that's changed in dentistry is techniques, and this instrument I brought over is a diode laser, and it's very portable. It used to be a very big machine, but today it's portable. We can use it almost anywhere, and we use it for a lot of different procedures.
This is actually the laser you have in your hand?
Yeah, this is the laser, and we actually can use it, and we can actually draw and sculpt on the patient's tissues and teeth, and we have some examples of where we use that.
Give us. Tell us, how do we use
Well,
this?
let's start with tongue-tied.
All right.
So people have come to me, this patient came to me, and it's funny, Armin, he didn't talk as well, he couldn't extend his tongue. There's the before picture, and we actually used the laser. We, in about 5 minutes, just opened that up. He was able to push his tongue forward, he spoke better, and Armin, one of his things was he always wanted to whistle, and literally he couldn't whistle. So that's where we use the laser, very simply, almost no anesthetic, topical, and that's one place we use the laser.
All right, what's this?
A patient came to me, actually the wife of an attorney, and she had bit her cheek, hopefully not from aggravation. It had gotten swollen a little bit, and so again, in the past you used to have to do that with a knife. Today with a laser, in literally 30 seconds to a minute, we were able to take off that lesion. That's immediately after, and that picture, Armin, is just a week after. You can see how it's healed.
Wow, it's gone.
It's brilliant, and that's one of the things that we can do in dentistry today.
All right. Other uses of this machine. You've talked a lot about changing gum shapes. Is that what you do?
And often I refer to changing the architecture. And in the past you had to go to a specialist maybe and they used a blade to scribe it. Some cases that's still appropriate, but we're able to do that with a laser. This patient had come to me, and this was one that after checking her periodontal or gum condition or bone, I was able to use the laser. I raised the tissue so she didn't have what we would call a gummy smile. That's something a lot of people present with. She also didn't like the look, the color, the shape, and so we did 8 porcelain veneers after using the laser. So I have to tell you, with all these new treatments, things have really changed for patients.
Let's move away from the laser for a minute. X-rays are something that continues, I think, to concern people. They're afraid of getting cancer. You use X-rays all the time.
And so even on myself, my own family, once a year we get X-rays. We use a now digital X-ray. It's over 90% less radiation. It's also environmentally friendly. We don't throw out cardboard and lead. In fact, a full set of X-rays is like being in the sun for 2 to 3 minutes. So I tell patients, maybe stay out of the sun. This is a great place to be in Cleveland. You can have lots. People always worry. There's the instrument that we use to take the X-rays. Again, no films anymore. We go patient or tooth to tooth. And this is a patient looking at her X-rays. So not only is it over 90% less radiation, but I can educate the patient. They can see right in front of them what the issues are that we're concerned with. So that's a fabulous new thing.
And people who have been separated from their loving dentists for a period of time may be surprised at materials being changed these days. What's this we're talking about?
Well, let's talk about couples as we approach Valentine's Day. A wife suggested that her husband come in to see me. He had all old porcelain on metal crowns. He said, I want a new smile. He's in his 70s, and she said, I really want to look across the table and enjoy his smile. So we used all porcelain there, no metal at all. We did some porcelain crowns in the front. We did porcelain veneers on the bottom. We also used that laser to make the teeth length uniform, and that was his smile. Well, guess what, Armin? When he was done, she said, all right, now it's my turn. He looks better than me. So that was her before picture. Again, we used the laser that we talked about. Her lower teeth had crowded. We had talked about braces. She said, I'm in my 70s. I'm not going to do that. And so with porcelain veneers, we gave her that after smile. A huge difference. And there's the couple, the proud
look at
couple.
that. Very
They're
nice.
fabulous people, very gregarious, wonderful relationship, and now they have similar smiles just in time for Valentine's Day.
Thanks for a dental love story. Appreciate that, Steve.
You're welcome, Armin.
So Cupid, or I should say dentist Steve Marsh, can help you make up with your mouth to give yourself a smile you'll love. Find out more, use the information that's coming up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, women's health talk that hits below the belt.